Hello, in this video we'll talk about obesity. Obesity is a complex disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern. It's a medical problem that increases the risk of other diseases as well. So, obesity can be estimated by calculating the body mass index. So, or BMI. BMI is a ratio of weight of the body expressed in kgs divided by height of the individual in meter squared. So, this ratio is indicative of your body mass. So, if this ratio is lesser than 25, it is considered normal. If it is greater than 25 and it is in between 30, then you are slightly overweight. If this ratio is more than 30, then you are obese. Obesity is life threatening because it is associated with several other diseases such as heart attack, stroke, type 2 diabetes, cancers, etc. In simple words, obesity is the silent killer. According to CDC, 40% of the population in US has a high chance of developing obesity, which is a big concern. We need calories for our functioning, and the calories comes from food we take, such as carbohydrate, protein, or fat. That gives us the energy we need to keep ourselves going. But the problem occurs when we eat more and spend less. In simple words, we exercise less. So in that situation, body stores the excess energy in other forms. So it also matters what kind of food we eat, whether we are eating healthy food versus unhealthy food. When we eat more calories and we are able to burn less calorie, then we are at a state of calorific excess. Body can deal with these excess calories in three possible ways. First of all, it can convert the excess fuel to fat and store it in an adipose tissue. Second, body can burn the fuel by doing exercise. Lastly, there could be wastage of this excess fuel via production of heat. Now, our body is evolutionary trained to store excess calories in terms of fat because in the early days there was not so much of availability of food. So whenever body has some amount of calorie which is excess, it would store it for the future. That worked like a survival strategy in the past. But nowadays we have plenty of food, so we never go to a state where we are devoid of food or devoid of calories. Excess calories along with sedentary lifestyle created a huge problem, and this is the result. We are getting obese. In our population, the fraction of obese people are increasing day by day. Dealing with obesity requires proper knowledge, and we need to understand what are the checks and balances that our body applies to control the body weight, because many of these mechanisms are compromised in obese individuals. So there is a lipostat hypothesis. It turns out our body can estimate how much fat we have, and it try to keep the fat in a balanced state known as set point. Now when our fat level increase or decrease, our body can sense that via plethora of sensors. These sensors can interact with several molecular players, and ultimately it can bring down the fat or bring up the fat into a set point level. And this homeostatic mechanism is crucial for weight management. Obviously, we can understand in obese individuals, one possible aspect is the defect of these lipostat mechanisms. One such sensor is leptin, which is a hormone secreted by adipose tissues itself. This hormone carries a message that fat reserves are sufficient, so in this particular point, fuel intake should be decreased and expenditure of the energy should be increased. Now, when mass of the adipose tissue increases, leptin secretion also increase. Increased leptin secretion inhibits feeding and fat synthesis. Also, it stimulates oxidation of fatty acids. When mass of the adipose tissue decreases, insulin secretion and also the leptin secretion decreases. This results in greater food intake and less fatty acid oxidation. Now you must be wondering that you are eating a lot, but your friend, which is very lean, he eats a lot but never get fat. Why is so? So obesity is not directly proportional to the calorific input. It turns out there are complex genetic, neuronal and hormonal mechanism that regulates our feeding and fasting behavior. Leptin modulates our hunger circuit. In simple words, we have two different categories of neuron in our hunger circuit: anorexigenic neuron and orexigenic neuron. Orexigenic neurons promote eating, whereas anorexigenic neurons inhibit eating. Leptin positively stimulates the anorexigenic neuron or eat less neurons and negatively stimulates eat more neurons. As a consequence, our hunger feeling is suppressed when leptin is more, and we end up spending more and more calories. Now, this leptin or the leptin receptor is encoded by genes. So any mutation in leptin gene or the gene that produce leptin receptor could be the underlying cause of obesity as well. This is a list of genes that are associated with obesity as per CDC. So now we understand that underlying obesity, there could be several reasons. One of that could be genetic as well. And recent research has shown beyond genetics, epigenetic mechanisms are also involved in obesity. All these genetic and epigenetic mechanisms are not in our control. But we can modify our lifestyle, we can restrict our calorific input, we can increase our exercise to manage our body weight. Nowadays, intermittent fasting is really popular practice to reduce your body weight and keep a check on it. Intermittent fasting can help in weight loss and weight management in obese individuals. In intermittent fasting, you fast for 16 hours approx and you have a feeding window of 8 hours. This ensures body can utilize all the fat during these fasting period, and it can break down the fat to make energy. If you want to learn more about intermittent fasting, you can click on the video in the I button. Other than intermittent fasting, dietary modifications such as keto diet, low carb diet could be useful for weight loss. If you want to learn more about that, you can again click on the I button. So in this video, we learned many things about obesity. We learned that obesity is a common disease. It's kind of like a lifestyle disease which is affecting every age group in our population. Obesity can be genetic and sporadic as well. We also looked at the underlying mechanisms that can trigger obesity. We learned about leptin as a regulator of hunger behavior and calorific input. So if you like this video, give it a quick thumbs up. Don't forget to support me on Patreon. If you're an Indian viewer, you can support me in Bhim UPI. Your contribution means a lot for me. And you can subscribe to my channel. You can share with your friends, you can like it, and don't forget to let me know in the comment how you like my videos. By the way, my courses are also present in Unacademy, so you can use my code AP10 to get a 10% discount. Thank you.